Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Imagine a world where a simple cut could turn deadly. I mean, that's what we're facing if we don't get a handle on antimicrobial resistance. It's something that a lot of you have been asking for a deep dive on, and we've got a great source to unpack today, a big new report from the European Food Safety Authority and the European Center for Disease Prevention and Control.
Yeah, and what's really interesting about this one is it's not just about human health. It brings in information about animals used for food production, so we get that One Health perspective, how it all connects the humans, the animals, and the environment.
Okay, so big picture stuff, but before we get lost in the weeds, can you give us the rundown on what exactly this report covers?
It's pretty massive in scope. They've got data from 27 EU member states, the UK, well, Northern Ireland specifically, and 5 non-member states. And they looked at resistance in bacteria from both humans and animals. So it paints a pretty detailed picture of what's going on across Europe.
A lot to unpack there. Let's dive in, maybe starting with salmonella. Everyone's heard of salmonella. It's a pretty common cause of food poisoning. What did they find about salmonella resistance?
Well, let's start with some good news. Resistance to those last resort drugs, azithromycin and tigecycline, that's thankfully low in salmonella from humans. You know, those are the drugs doctors turn to when nothing else works, so that's a relief.
Okay, that is good news, but I have a feeling there's a but coming.
You're right, there is a but. Resistance to those individual drugs might be low, but there are some worries about combined resistance. So some salmonella types, for example, Kentucky, that's often found in chicken and in infantis, you see that one in turkeys. They show high levels of resistance to both ciprofloxacin and cefotaxime, and we see those levels mirrored in human infections.
So even if resistance to each individual drug isn't a huge problem, there are some salmonella out there that are resistant to multiple drugs, which makes treatment a lot harder.
Yeah, exactly. Those treatment options get really limited when you're dealing with combined resistance. And on top of that, the report highlights this globally spreading clone called Salmonella Kentucky ST198. It's known for high resistance to ciprofloxacin, so this isn't just a European issue, it's worldwide.
That's concerning for sure.
Yeah.
Did they find any differences in salmonella resistance depending on what kind of animal it came from?
Oh, yeah, absolutely. There's a lot of variation. So, for instance, salmonella from pigs in Northern Ireland and a few other countries that showed really high multi-drug resistance, meaning they were resistant to a bunch of different antibiotics. But then in contrast, multi-drug resistance was a much lower in salmonella from laying hens.
Interesting. So it seems like where that salmonella comes from, what animal, that really matters for how likely it is to be resistant to drugs.
Mm-hmm.
The report also mentioned tigecycline, that last resort drug we talked about. What's the situation with that?
Well, there is some concern about emerging resistance to tigecycline. The good news is that these highly resistant TET-X3 and TET-X4 genes, they haven't been found in the EU yet. But here's where that whole One Health idea comes in. These genes have been found in animals in China.
Wait, so why should we care about what's happening in China?
Well, because some of these resistance mechanisms, they can be transferred between bacteria. It's almost like they can share cheat codes to outsmart the antibiotics. So a bacterium in China could actually pass on its resistance to a bacterium here in Europe.
Okay, yeah, that's unsettling. So even though the EU hasn't seen those specific resistance genes yet, it's possible they could show up, through global trade or travel.
Exactly. And that's why it's so important to have that global perspective. International collaboration is key if we want to tackle this effectively.
That makes a lot of sense. Let's switch gears now to another bacteria that's pretty common in food, Campylobacter. What did the report tell us about Campylobacter resistance?
Campylobacter is an interesting one. It's kind of a mixed bag. The good news is that overall, combined resistance to ciprofloxacin and erythromycin is lower in Campylobacter jejuni compared to Campylobacter coli. And Campylobacter jejuni, that's the one that's more commonly linked to infections in people. So lower resistance there is a good thing. But there's a catch.
Of course there's a catch. Lay it on me.
So while combined resistance might be lower in Campylobacter jejuni overall, Campylobacter coli from cattle that showed really high levels of combined resistance to those same 2 drugs, we're talking around 30%. And Campylobacter coli can still infect humans, so it's not something we can ignore.
30%, that's a pretty significant number. And you said ciprofloxacin and erythromycin, those are often used together, right? What happens if those don't work?
Well, that's where things get even more tricky. The report found moderate to very high resistance to gentamicin and ertapenem in Campylobacter coli from cattle. And those are the drugs that doctors would typically recommend for severe Campylobacter infections in humans. So if resistance levels were high there, it could make treatment a real challenge.
So we're basically running out of options for treating those severe cases if this resistance keeps going up. That's a little scary.
It definitely highlights how urgent it is to address this issue. But there are some bits of good news. When we look at trends over time, we see that ciprofloxacin resistance in Campylobacter jejuni is actually going down in some countries like Spain, Finland, and Norway.
Okay, so it's not all doom and gloom. It is possible to turn the tide on this, at least in some places. What about E. coli? That's another one we hear a lot about when it comes to foodborne illness. What's the story there?
E. coli is where we see some of the most encouraging news from the report. A lot of countries are reporting decreases in E. coli resistance to a whole bunch of important antibiotics, things like ampicillin, ciprofloxacin, cefotaxime, tetracycline, and colistin. And the report even points to the fact that antibiotic use in animals has been decreasing since 2011, and that's likely playing a role in this improvement.
That makes sense. If we're using fewer antibiotics in animals, it stands to reason that we should see lower resistance in the bacteria that affect them. And hopefully that translates to a lower risk of those resistant bacteria making the jump to humans too.
Right, exactly. It suggests that the efforts to reduce antibiotic use are actually making a difference, which is really encouraging. It means we can change the trajectory here.
A little bit of optimism. I like it. Now, this report also gets into some pretty complex resistance mechanisms, extended spectrum beta-lactamase producing bacteria and carbapenemase producing bacteria. Can you try to break those down for us?
Well, those are definitely mouthful terms. Basically, they describe bacteria that have developed ways to resist certain important antibiotics, like cephalosporins and carbapenems. They basically produce these special enzymes that can break down the antibiotics.
So it's like they have this secret weapon to fight off the drugs we use to treat infections.
Yeah, that's a good way to put it. And what makes this even more complex is that the genes that encode for these resistance mechanisms, they can jump between bacteria pretty easily. So you could have a harmless bacterium in your gut that passes on the code for the weapon to a more dangerous bacteria, making it resistant to multiple antibiotics.
Okay, yeah, that's pretty scary. So how common are these resistant bacteria in Europe? Are we talking about a full-blown superbug crisis?
Not quite. The report indicates that based on routine monitoring, the occurrence of these resistant bacteria was generally low in both 2022 and 2023. But, and this is important, routine monitoring methods, they might not catch everything.
So there could be more out there than we're currently picking up.
That's definitely a possibility, and that's why the report stresses how important it is to have specialized monitoring programs. They use targeted techniques to identify these specific types of resistant bacteria.
So it's like having a special ops team dedicated to tracking down these microscopic villains. So what did they find when they used these special methods? Anything alarming?
Yeah, there were some red flags. For instance, they detected a significant number of carbapenemase-producing E. coli in broiler chickens in 2022, and smaller numbers were found in cattle and pigs in 2023.
And carbapenems, those are kind of a last resort for treating a lot of serious infections, right?
Exactly. They're like the big guns we pull out when nothing else works. So finding carbapenemase-producing bacteria in animals that are used for food production, that's definitely concerning. It suggests that these resistance mechanisms are making their way into our food chain, which could have serious consequences for human health down the line.
It's a good reminder of how interconnected human and animal health are. What happens on farms can directly affect what happens in hospitals.
100%. And it underscores the need to be doing a lot of things to address this. Using antibiotics responsibly in both humans and animals, improving how we monitor these trends, and putting resources into developing new antibiotics or other treatments.
Seems like we're up against a pretty complex challenge, but at least this report is giving us a lot to work with. Before we move on to part 2, can you give us a quick recap of the key takeaways for each bacteria we've talked about?
Sure. For Salmonella, the big concern is that combined resistance, especially to ciprofloxacin and cefotaxime, and that's popping up in certain types of Salmonella. For Campylobacter, it's those high levels of combined resistance in Campylobacter coli from cattle, and that's worrying because it could limit our treatment options for severe infections. For E. coli, we've got some good news. We're seeing resistance to a number of key antibiotics going down, and that's likely because we're using fewer antibiotics in animals. For MRSA, it's the rifampicin resistance that's raising eyebrows because rifampicin is really important for treating tuberculosis, so that's a potential problem. And finally, for enterococci, the problem is we just don't have enough data because monitoring isn't mandatory, so it's hard to get a handle on the true extent of the risk there.
A lot of information to digest. We'll take a quick break and be back soon with part 2, where we'll dive into the nitty-gritty of those more complex resistance mechanisms, those extended spectrum beta-lactamase, AMPC beta-lactamase, and carbapenemase producing Salmonella and E. coli. We'll also look at what this all means for human and animal health, so make sure to stick with us.
Welcome back to our deep dive on antimicrobial resistance. Before the break, we were talking about some pretty complex resistance mechanisms. Maybe we could unpack those a bit more. Those extended spectrum beta-lactamase producing bacteria, the AMPC beta-lactamase producing bacteria, and the carbapenemase producing bacteria.
Yeah, those are definitely some mouthful terms. But I remember you were comparing it to bacteria having these secret weapons. Can you remind us why those weapons are so concerning?
Right. Well, these bacteria, they've evolved to produce enzymes that can basically break down certain antibiotics, and that makes those drugs ineffective. It's a big problem because these enzymes, they can actually target some of our most important antibiotics, like cephalosporins and carbapenems.
And just to make things even more complicated, you mentioned that the genes responsible for these resistance mechanisms, they can jump between bacteria.
Exactly. So imagine this, a harmless bacterium just hanging out in your gut. It could pass on the genetic code for this weapon to a more dangerous bacteria, and then boom, that one becomes resistant to multiple antibiotics. It's like they're sharing blueprints for how to build these antibiotic-destroying machines.
That sounds like a recipe for disaster. So how widespread are these resistant bacteria in Europe? Are we talking about like a full-blown superbug crisis?
Well, not quite, fortunately. The report says that based on routine monitoring, the occurrence of these resistant bacteria was generally low in both 2022 and 2023. But, and this is a big but, routine monitoring methods, they might not catch every case.
So there could be more of these superbugs lurking out there than we realize.
Yeah, it's possible. And that's why the report really highlights the importance of these specialized monitoring programs. They use much more targeted techniques to identify these very specific types of resistant bacteria.
It's like having a special ops team, but for tracking down microscopic villains. So what do they find when they use these specialized methods? Anything alarming?
There were some red flags for sure. For example, they found a pretty significant number of carbapenemase-producing E. coli in broiler chickens back in 2022. And then in 2023, they found smaller numbers in cattle and pigs.
And carbapenems, if I remember correctly, those are considered a last resort for treating a lot of serious infections, right?
You got it. They're like the big guns that we reserve for when nothing else works. So finding carbapenemase-producing bacteria in animals that are used for food production, well, that's definitely a cause for concern. It suggests that these resistance mechanisms are finding their way into the food chain, and that has some potentially big implications for human health down the road.
Yeah, it's a stark reminder that human health and animal health, they're really intertwined. What happens on farms can directly impact what happens in hospitals.
Absolutely. And it just really underscores that we need a multi-pronged approach to tackle this. We need to be using antibiotics more responsibly in both humans and animals. We've got to improve how we're monitoring these trends, and we definitely need to invest in developing new antibiotics and other kinds of treatments.
Sounds like we've got our work cut out for us. This report's given us a lot to think about. Any limitations we should be aware of before we move on?
That's a good question. And yeah, like any large-scale study, there are some limitations to keep in mind. I think one of the biggest challenges is that there's a lot of variation in how different countries monitor and report these things. Some countries have much more robust surveillance programs than others, so it can be tough to make direct comparisons across the board.
So the data might not be like perfectly apples to apples.
Yeah, exactly. It's something to keep in mind when we're interpreting the results. And another thing is that the report mainly focuses on what we call microbiological resistance. So that means that the bacteria are tested in a very controlled lab setting.
So how does that translate to real-world scenarios?
Well, think of it this way. It's kind of like assessing a boxer's strength and technique in the gym. It gives you a pretty good idea of what they're capable of, but it doesn't necessarily predict how they're going to perform in a real fight. Similarly, how bacteria act in the lab, it doesn't always perfectly reflect how they behave in a human body, where there's all these other factors at play, like the immune system and other medications people might be taking.
Right, that makes sense. So the lab data is valuable, but it's just one piece of the puzzle. We need to consider how this all impacts real people in the real world.
Exactly. And that's where the expertise of folks like infectious disease specialists and epidemiologists and veterinarians, that's where it becomes really critical. They help us to interpret the data, identify any gaps in our knowledge, and develop strategies to combat antimicrobial resistance effectively.
Speaking of experts, have you come across any interesting opinions or perspectives on this report that you think our listeners would find insightful?
Actually, yeah. I was talking to a Dr. Sarah Jones recently. She's an infectious disease specialist, and she's been following this antimicrobial resistance research very closely. And she emphasized that we really need to focus on improving diagnostics. If we can quickly and accurately identify the specific bacteria that's causing an infection, then we can tailor the antibiotic treatment much more effectively. And that can help to reduce unnecessary antibiotic use and slow down the spread of resistance.
So it's about using the right tool for the job, not just throwing antibiotics at every infection.
Precisely. And Dr. Jones, she also highlighted the importance of public awareness campaigns. A lot of people, they still don't fully grasp just how serious this problem is. They don't understand how their actions can contribute to it. Simple things like completing a full course of antibiotics when they're prescribed and avoiding unnecessary antibiotic use. Those things can make a huge difference.
It sounds like this isn't just a problem for scientists and policymakers to solve. We all have a role to play.
Exactly. Everyone can be part of the solution. Which leads us to a really important question. Why should our listeners care about these trends in bacterial resistance? What are the real-world implications here?
That's a great point. It's easy to get lost in the technical details. But this isn't just some abstract science. It affects all of us.
Absolutely. Antimicrobial resistance, it has the potential to completely undermine decades of medical progress. It could make common infections much more difficult to treat, and in some cases, maybe even impossible. Imagine a world where a simple cut or a urinary tract infection, something that's relatively easy to treat now, imagine those becoming life-threatening.
That's pretty sobering when you put it that way. This isn't just something for doctors and scientists to worry about. It affects everyone.
100%. We're all in this together. But the good news is we can make a difference by understanding the problem, by making informed choices about our health, and by advocating for change. We can help protect ourselves and future generations from this threat of untreatable infections.
That's a much more empowering message. We're not powerless in the face of this challenge.
Exactly. We have the power to act. And that's what we're going to delve into in the final part of our deep dive. We'll be discussing specific steps that individuals, healthcare providers, and policymakers can take to combat antimicrobial resistance and make sure these life-saving drugs remain effective.
So we've spent this whole episode talking about antimicrobial resistance, and it's obviously a big problem, a global health threat even. But knowing about it's only half the battle, right? We've got to actually do something about it. So let's talk solutions. What can we actually do to combat antimicrobial resistance?
Well, the good news is that there are things we can do, both as individuals and collectively. It might seem overwhelming, but it's not a hopeless situation.
Okay, good. Because it can feel a little overwhelming, to be honest.
So let's start with those individual actions. What can our listeners actually do, in their everyday lives to make a difference here? Well, one of the most basic, but honestly most effective things is just practicing good hygiene. Washing your hands a lot, especially before you touch food or after using the bathroom. That can really cut down on the spread of bacteria, including the ones that are resistant to antibiotics.
Yeah, you always hear those public service announcements about hand washing, but do they really make a difference? It seems so simple.
Oh, they absolutely do. It's not just about being clean, it's about stopping that chain of transmission. Washing your hands is one of the best ways to prevent infections in the first place, and that includes the infections caused by these resistant bacteria.
Okay, so hand washing is a must-do. What else can we do as individuals?
Another big one is using antibiotics responsibly. And that means a few things. Only taking antibiotics if they're prescribed by a doctor, following the dosage instructions exactly, and this is important, finishing the entire course of treatment, even if you start feeling better before you've taken all the pills.
You know what? I have to admit, I've been guilty of stopping antibiotics early when I felt better. Is that really bad? Why is it so important to finish the whole course?
Yeah, you really want to avoid doing that because when you stop antibiotics early, it can actually allow some of the weaker bacteria to die off, but then the tougher ones, the more resistant ones, they survive. It's kind of like if you were weeding a garden, but you only pulled out the little weeds and left all the big, strong ones behind. Those survivors, they can multiply and spread, and that makes the resistance problem even worse.
Wow, so I was actually making things worse by trying to do the right thing. I mean, it's incredible that something so small can have such a big impact.
Yeah, it shows how everything's connected. Our individual choices, they really can have ripple effects on this whole bacterial ecosystem.
Mm.
We have to think bigger than just ourselves and realize that our actions affect everyone.
Okay, good points. So those are some things we can do personally. But what about the bigger picture? What can doctors and policymakers do to address this?
Well, healthcare providers, they have a huge role to play in making sure that antibiotics are only being prescribed when they're really needed. And they can also educate patients about how to use antibiotics responsibly and explain the risks of resistance. It's not just about writing a prescription, it's about having that conversation and empowering patients to make good decisions about their health.
So it's a team effort, doctors and patients working together to tackle this.
Right. And on the policy level, we're seeing more and more emphasis on these antibiotic stewardship programs in hospitals and other healthcare settings. Those programs, they focus on using antibiotics wisely, reducing unnecessary prescriptions and preventing the spread of resistant bacteria within those facilities.
That sounds like a good step. What other policy measures could be helpful?
Well, investing in research and development for new antibiotics and other kinds of therapies, that's absolutely critical. We've got to stay ahead of the curve because bacteria, they're always evolving. It's like an arms race, trying to keep up with their ability to develop resistance.
So we can't just rely on the drugs we have now. We've got to be coming up with new ones, new tools to fight these infections.
Exactly. And we also can't forget that this is a global problem. Antimicrobial resistance, it doesn't respect borders. So we need international collaboration if we're going to make real progress. Sharing data, sharing best practices, working together on research, it all matters.
This has been such an informative deep dive. A lot to think about, that's for sure. As we wrap things up here, any final thoughts you want to leave our listeners with?
I guess just to emphasize that antimicrobial resistance, it's serious, but it's not unbeatable. If we understand the problem, if we make smart choices, and if we advocate for change, we can all contribute to a healthier future, not just for ourselves, but for everyone.
Well, that's a good note to end on. Thank you for taking us on this deep dive. And to our listeners, remember, you're not just bystanders in this fight. You can actually make a difference. Stay informed, get involved, and let's work together to protect these life-saving medicines.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.